Thank you, Mr. Chairman. Healthcare costs have risen astronomically from where they were just a few decades ago to now approaching 18% of our GDP. And it's all occurred very simply because the healthcare industry has disguised itself as being part of free enterprise, which embraces transparency, competition, no barriers to entry, and most importantly, an engaged consumer. You know that none of that really applies to our current industry. You've heard the chairman talk about when you do operate like an unregulated utility, you're going to have government getting involved. So the key is, do we go there when this place is going broke systematically over the last decade or two and at a place that's running $2 trillion deficits? Or do we reform the industry? For anyone that is a CEO within the industry, I would suggest that you do what all the rest of us have done that run businesses: embrace competition, deal with an engaged consumer, and full transparency. I mean, if we keep going down this trail, we're going to end up not only exacerbating the $2 trillion deficits we currently have, it's going to get even worse. I was able to keep costs low in my own business. It can be done. I was so sick and tired of hearing how lucky I was that it was only going up 5 to 10% every year. Found out how much the insurance companies were making on then what was a 300-employee plan that hardly had any claims, but they were making a fortune on it. And that's because even we did not have the full breadth of options. And when I found out how lucrative it was to be in the insurance business, we self-insured. And then threw everything in the kitchen sink at prevention and wellness, and actually on the user side only, controlled costs. My employees got every wellness and prevention tool, and they became healthcare consumers. And in that method, we cut costs by over 50%, have not had premium increases in 16 years. Industry, wake up. It can be done. We need more tools, and we need you to get with it. President Trump put in place regulations requiring hospitals and insurers to disclose prices. President Biden has continued to support it. Hospitals have tried to skirt it, mostly from the time that happened. Today, I'm releasing a report that highlights the need for Congress to enact additional transparency across the healthcare supply chain. This is not going to go away, and it is a single place in our federal government that if we get it right, we can reduce our deficits. The government will have a bill to pay that's less if the providers shrink themselves down to where it is in most other economies, and maybe not do it from a command system from government, but because entrepreneurialism and the markets are working. The House passed the Lower Costs, More Transparency Act. That's a huge step to get us where we're needing to go. I'm on health, education, labor, and pensions. Another crazy thing about this place, they got a hearing right now. It's at the same time this is, and we've never gotten that straight since I've been here. I'll try to jump there. But Bernie Sanders and I introduced the Healthcare Price Transparency Act 2.0, a landmark bill to reveal healthcare prices for Americans that mirrors the House bill in many ways. I want to thank Senators Warren and Fetterman, who are members of this committee, for joining as co-sponsors. I want to cite someone in the audience here, Cynthia Fisher, who has been the most passionate individual I know. She's run a business over the years about keeping this in the limelight. It requires providers to publish actual prices, not estimates. Another major component of the bill states that group health plans have the right to review and audit their own claims data, and we can't do that. That's got to happen. Nationally, and states need to accommodate that. This will allow self-insured employers and unions to make changes to their plan and save money for their beneficiaries. Our bill puts the power back in the hands of Americans. It starts to make it consumer-driven, and it starts to break up the oligopoly, the monopoly nearly, of how health care is provided currently. I ask unanimous consent to enter into the record two statements, one from Power to the Patient and another from patient rights advocates with 75 signatures in support of this legislation.
Without objection.
Look forward to continuing to work with my colleagues on both sides of the aisle to get the Healthcare Price Transparency Act 2.0 to the President's desk. It is time to deliver for our seniors, families, and Americans all across the country. I would like to play a video telling just one of the thousands of stories about the impact price transparency can have on patients. Thank you to Patients' Rights Advocate for submitting this story and for their leadership in the fight to bring power to patients.